Are you taking gabapentin? If so, let's talk about this common medication and some crucial things you should know about gabapentin. Now, gabapentin is widely prescribed for conditions like diabetic neuropathy, seizures, and fibromyalgia. But here's the thing, like any medication, gabapentin has certain considerations to keep in mind to ensure it's safe and effective for you. So in this video, I will share with you what to avoid while taking gabapentin to help you get the best results and minimize potential side effects. You see, understanding these factors is critical as they can significantly improve gabapentin's effectiveness and reduce unwanted side effects. As you may already know, gabapentin can cause many side effects such as dizziness, swelling in the hands and feet, weight gain, and lack of coordination, to name a few. This is precisely why it is important to be mindful of what we are about to discuss, as they can potentially worsen these side effects. JedosaThePharmD here, welcome and please like and subscribe to the channel. Number 1. Alcohol. Now, one of the big no-nos when you are taking gabapentin is drinking alcohol. I know sometimes after a long day, a glass of wine or a cold beer sounds perfect. But trust me, when you are taking gabapentin, combining it with alcohol is a recipe for trouble. You see, mixing gabapentin with alcohol can increase dizziness and drowsiness. And let's not forget about the risk of severe side effects like impaired motor skills and breathing problems. As you can see, this can be a huge problem, and that's not the outcome anyone wants. So what is the takeaway here? Well, if you are taking gabapentin, it's really best to avoid alcohol entirely. Number 2. Antacids. One key thing to remember when taking gabapentin is that it does not mix well with antacids. Let me explain why. Antacids are those chewable tablets or liquids we take to help with heartburn or other stomach problems. You see, antacids contain ingredients like aluminum hydroxide and magnesium hydroxide. These ingredients can interfere how your body absorbs gabapentin. Now, here's what happens. After taking your gabapentin, it travels to your stomach and is absorbed into your bloodstream. However, if you have recently taken an antacid, those ingredients can bind to gabapentin. This means less gabapentin gets absorbed, making it less effective. As a result, you may not get the full benefits of your gabapentin. So what can you do? Well, the good news is that it's simple to avoid this interaction. Just make sure to take gabapentin at least 2 hours after taking an antacid, or wait at least 2 hours after taking gabapentin before taking antacid. This way you give each medication enough space to do its job without interference. Number 3. Antihistamines. When it comes to managing allergies, sleep issues, or cold symptoms, medications like Benadryl or diphenhydramine and daxylamine are often top choices. But here's the thing, the problem comes when these medications are taken together with gabapentin. You see, both gabapentin and antihistamines can cause sedation, which means they can make you feel excessively drowsy and sleepy. And in more severe cases, they can even cause breathing difficulties. Now, taking one medication that makes you drowsy can be manageable, but when you combine 2 or more, the effects can multiply and cause some serious issues. So if you are already on gabapentin and need relief from allergies, talk to your provider or pharmacist for safe alternatives such as saline rinse that will not interact negatively with your gabapentin. This way you can effectively manage your symptoms without compromising your safety. Number 4. Sleep medications. If you have problems falling or staying asleep, your doctor may recommend popular sleep medications such as Zolpidem or its brand name Ambien. But I'm here to tell you that combining sleep medications with gabapentin is a big no. Now, you may be wondering, Why is this combination so risky? Well, here's the deal. Both gabapentin and sleep medications have sedative effects. So when you take them together, these effects can be multiplied, leading to increased drowsiness and dizziness. And let's be real, none of us wants to deal with that. This risk is even higher, especially if you are 65 or older. You see, as we age, our bodies metabolize medications more slowly, and the chances of side effects increase. Therefore, mixing these two medications can lead to confusion, falls, and in severe cases, it can be life-threatening. Number 5. Antidepressants. Taking antidepressants can be life-changing for many people, helping to manage symptoms of depression, chronic pain, and other mental health conditions. But when you combine gabapentin with antidepressants, especially tricyclic antidepressants such as amitriptyline, things can get a little tricky. This is because they can interact in the ways that are not so friendly. Both gabapentin and tricyclic antidepressants work by affecting the brain's neurotransmitters, which are the chemicals that help transmit brain signals. Now, when you take these medications together, it can result in an overload, which can potentially cause serious side effects. For example, combining these medications can increase side effects like dizziness, drowsiness, and confusion. Imagine trying to go about your day constantly feeling dizzy. It's definitely not ideal. In addition, both medications can depress your central nervous system. This means your heart rate and breathing can slow down to dangerous levels. Number 6. Valerian root. Valerian root is a natural supplement that has been around for centuries, and many people use it to help with sleep and anxiety. You see, it works by increasing the levels of a chemical in your brain called GABA, which is known for promoting relaxation. But here's a word of caution. Just like sleep medications and antidepressants, mixing valerian with gabapentin is not a good idea. They both have sedative effects, meaning they can make you feel drowsy or sleepy on their own. So when you take them together, these effects do not just add up, they multiply. Imagine doubling the dose of your sleep medication. You could end up feeling excessively drowsy, dizzy, or even lightheaded. So it's best to avoid using valerian root and gabapentin at the same time to stay safe. In addition to what we have discussed in this video, there is one more important thing to keep in mind. Avoid taking gabapentin with certain other medications. This includes opioids, benzodiazepines, cimetidine, and pregabalin. And there you have it. Remember, knowledge is the key that unlocks the doors to a healthier and happier you. Thanks for watching.